Hello, my name is Jochen Tunkel and I'm a periodontist and oral surgeon in Bad Oeynhausen in Germany. First of all, again, the personal protection equipment is the most important initiative because we had to look that we are never running short of it. And for example, there was a scarcity of face masks at the beginning of the year, and so we ordered. And if we have all the personal protection equipment, that's an important thing to see the patients. Of course, separating the patients from each other to reduce patients coming to the office, that they don't meet each other and that they can keep the distance. We posted information for the patients on our website and Facebook and Instagram, and we explained the situation. And that's, I have to say, I learned from the social media, from other colleagues, what they did and what they posted. And I adopted and adapted these things and implemented to our daily routines. And that was very helpful. I instructed my receptionist, because she's usually the first of our staff which gets in contact with the patients via telephone or directly when they enter the office. And I instructed her what to tell the patients so that they feel safe. And of course we hung up the information sign at the entrance, all the things that people have to do. And this is just a complement to what we did in our daily routine before the crisis.